Well, hey there, and welcome to another episode of Coshocton Conversations. I'm your host, Kirby Hasseman, and we are in the Hasseman Brewing Tap Room, where we want good people to have good conversations. And we've got a great conversation lined up today with Mary Ellen Given. Mary Ellen's in marketing here at the Coshocton Regional Medical Center. That rolls off the tongue. And so thank you for joining me. I appreciate it.
Thank you.
Cool. So let's just dig in with the basics. Tell me a few things that are going on at Coshocton Regional Medical Center and some good projects you're working on.
Well, probably the most exciting is a project that we're calling Get Treated, Not Seated.
Okay.
And this is something that has actually been going on for the last year and a half. And that is, we took a look at how long people have to wait when they come to the emergency room. The absolute worst thing that you want to do. And we broke it down into every element of that wait and looked at all the things that weren't necessary. So our first successes came about a year and a half ago, and we took our average wait times and that would be from the time you enter the door until the time you either leave to go home or are admitted upstairs. We took those from over 4 hours to less than 2.
Wow, that's huge.
Which is really amazing.
Yeah.
It has brought other hospitals here to look at what we're doing, and it really is based on efficiency. So they're kind of like, this is exactly what we've wanted to do. How have you done it? We've kept it somewhat quiet, except we keep getting feedback from people saying, well, I didn't wait very long this time. I didn't wait long this time. And that's by design. And everybody is on board, all the nurses, the doctors, everyone's on board to make sure that when you come in, you're not taken to the waiting room. You may be there a second or two, but then you're taken right to be put in an emergency room bed. There's no reason why the doctor or the nurse can't triage you and find out the elements of what's going on. But that gets your care to you so much quicker, and it gets you to where you need to be so much quicker.
And I would think it would be from a mental perspective too, right? Like if things are happening right away, it even just makes the whole experience feel different.
Right. When you walk in that door, you want to be seen.
Yeah.
Now our philosophy is when you walk in that door, we want to see you. We want to get you the care you need right away. We have doctors who will be at the nurse's arm saying, is there anybody out there? We want to make sure, we've got an empty bed, we need to have that one filled. So it's really, really important for us, and we have experienced tremendous success. We track it every single day.
That's so cool.
Now, that's not to say you may occasionally have a wait if we have a very serious trauma or an emergency of some sort that's going to take the doctor away a little bit more, but we're talking about average wait times.
Right.
So that means a lot of the times will be far less than that.
Right, yeah, that makes sense.
So that's very exciting.
Yeah.
Second thing we have that's really exciting is we're about to sit for our chest pain accreditation. What that means is we've been putting together the processes that we need to put together to make sure that if you come in with an active heart attack, you are from our door to the cath lab table, which would be intervention, within 90 minutes. Okay, we don't have a cath lab, so when you think about that, that means the treatment that you get, you're taken by whatever transport is necessary. We have all of the unnecessary elements removed so that you are right there to that cath lab within 90 minutes. We have already had months of success with this, but to get accreditation, you've got to sit for accreditation. So the testing will occur next month, and we're extremely excited about that.
Cool. Good luck.
Thank you. Well, I'm very, very confident. We have got a tremendous team working on it.
That's awesome. That's great stuff. So let me shift gears. So everybody's got challenges in their organization. So what's one burning challenge that you have right now?
It's pretty simple. It's kind of one little phrase, and it's called call 911.
Okay.
We can handle so many emergencies, but the things that we want to get across to people over and over again is if you think you're having a heart attack or a stroke, call the squad. Don't try to get somebody to drive you. Don't call your daughter. Don't call your neighbor, anyone like that. Because in both of those instances, heart attack and stroke, time is...
That's everything.
Yeah, that's your enemy.
Yeah.
So what can happen is, particularly with things like the chest pain accreditation and the emphasis we have on that, we can determine, is it an active heart attack or is it chest pain that may have another explanation that we can treat right there, or do we need to get you on for more elaborate care? And the same with a stroke. You only have a certain period of time where you can reverse the damage that could ultimately be done. It's important. One thing we have been doing very actively is going out, giving education on the early signs and symptoms of a heart attack, because it's not the elephant sitting on your chest anymore. There's recognition now that it can be a number of things that are the early signs that you're in for trouble with your heart. Shortness of breath, back pain. For women, it can be pain that starts in the center of the back and moves up to the jaw. It can be nausea. There are a lot of things that can be going on that are warnings of a heart attack. So don't take time to pause. Call 911. The squad will get things moving right away.
Get yourself in the hands of professionals as fast as possible, essentially, right?
Exactly.
Okay, so let's shift gears. What are some things in Coshocton County you're excited about?
I think there's a lot to be excited about.
I kind of
County
agree
right now. Yes, we have a lot of local businesses that are bringing some, excitement into the community. Jobs, places, manufacturing jobs like McQueen Ductile, the ethanol plant, Kraft, many others that are hiring right now, and are really looking for good candidates. I'm excited about the investments that have been made in the hospital to really improve our financial stability. We are stable, and give us the support we need to buy new equipment. And that's, we're just doing all kinds of things, working to catch up and to get ahead, and really improving safety and quality standards. Then there's the really obvious things like the bridge project.
Yeah.
I really like that. That's something that we've needed for so long. That's the entrance to our community.
Yeah.
So, paving work that's being done around town. New businesses like this one, other breweries and distilleries, stores, markets that are opening up. All of these improve the quality of life here. Places for people to gather, for people to talk, get rid of your phones for a while, whatever. Places like Clary Gardens and are some of the improvements that have been made to the community park system. A lot of health revolves around staying active, and those are great places for us to get out and about and be active and stay healthy. Then I also am proud of the people in this community who are working collaboratively to make improvements. The Drug Coalition, and I see people working on various coalitions and collaboratives that include, Sheriff's Department, the courts, the schools, the hospital, all kinds of people working together to do what needs to be done.
Yeah, I've totally noticed that, and it's actually been a theme, I think, on this show, and it's one of the things that I think is exciting, because I think you see organizations that have historically not that they've done badly, but they haven't worked together as much as they are today, and it's exciting to see. Yeah. So final question for you, what's a shout out? What's another organization or event in Coshocton County that you see as a positive?
Today's the first day of summer.
Right.
And so I have to mention Coshocton in Bloom.
Yeah.
I think that any place, anywhere you go in this community and you look around and you see these beautiful plants, and those don't happen by accident.
Exactly.
We have them at the hospital, and I'll walk out and there's a big plantings that are sitting nearby, or peat moss that's ready, and by next morning it's beautifully planted. Yeah. The people who work on this, and there are countless numbers of people, are really making a concerted effort to make Coshocton look very good. And I know that photos of those planters have appeared all over the country. They've been in publications, and it really is proof that good things start with just one small idea.
I love that. That's totally right. And what I love about that group too is they're doing it behind the scenes. They're not asking for any credit or anything like that. They're doing some amazing stuff.
That's right.
So thank you so much. I appreciate you doing this. All right, that's going to wrap up this edition of Coshocton Conversations. We'll see you next time.